Hello, my name is Kevin Ho, and today I'm going to be discussing the potential therapeutic benefits of psilocybin mushrooms and why I believe that they should be under consideration for medical legalization. Now, I know that many people still view the controlled substance as dangerous, and while I can respect that concern, I'm here to tell you that the profound potential therapeutic benefits beckon further research and more clinical trials. First, I want to inform you guys about the history of laws surrounding psilocybin and explain why psychiatric research surrounding psilocybin has been limited for so long. The 60s were a period of extremely heavy psychedelic use within the US population, particularly among the youth. According to John Vives of the Free Thought Project, psychedelic research began in the late 1950s and became a regular part of the youth culture by the mid-1960s. According to the Berkeley Foundation, the 1950s, 60s, and 70s were the most fruitful decades in the 20th century for psychedelic research. When looking at this chart, it's clear to see that there was a significant peak of psychedelic research that occurred in the late 1960s, and since then, there was a steady decline in psychedelic research until the early 2000s. In 1968, psychedelic mushrooms were made illegal with an amendment to the Food, Drugs, and Narcotics Act. Criminalization of psilocybin became common with the Controlled Substance Act of 1970, which listed psilocybin as a Schedule I controlled substance. While there are many theories suggesting different reasons as to why psychedelics were made illegal, it is clear that they were banned at the height of their use among the public. Ever since then, the research surrounding psilocybin mushrooms as a potential aid towards alcoholism, addiction, and as a therapeutic substance promoting mental health had to stop. Research was not allowed to continue on a large scale until October of 2018, and the Food and Drug Administration granted a breakthrough therapy status for research. Since the 1960s, there has been little to no academic research performed on psilocybin until very recently. However, we are now allowed to pick up where we left off and explore the untapped potential of psychedelic research. In the words of Dr. Roland Griffiths, we now have a class of drugs that was put in the deep freeze, and we can now pull them out and ask all sorts of questions. Some of the most profound and reputable studies have been published by Johns Hopkins medical research team, and they are continued to seek grants and opportunities to further study the medicinal potential of psilocybin. In 2006, they conducted a study surrounding the safety and long-term positive effects of a single dose of psilocybin. And this study, according to Alexa Ursulano of Johns Hopkins, is widely considered the landmark study that sparked the renewal of psychedelic research worldwide. In 2008, they conducted a study emphasizing safety as the cornerstone of psychedelic research, and according to Ursulano, techniques within this publication have been adopted by others in the field. So in 2014, Johns Hopkins published a groundbreaking study that defined a direct correlation between controlled, monitored use of psilocybin and the cessation of smoking among lifetime smokers. According to Sean Morris of Johns Hopkins, researchers report 15 study participants taking psilocybin achieved an 80% abstinence rate over 6 months, compared to an approximate 35% success rate for patients taking varenicline, which is widely considered to be the most effective smoking cessation drug. Varenicline is also known as Lexapro. In 2019, Johns Hopkins conducted an online survey of over 300 people with alcohol abuse disorder who reported reducing or abstaining alcoholic use after having taken the psychedelic drug. According to Ursulano, this study adds to the growing evidence for supporting further investigation of psychedelic-assisted treatment for alcoholism and substance abuse, which is one of the forefront aspects of psychedelic research being enacted in the 1960s. Later in 2019, a group of private donors donated $17 million to Johns Hopkins Medicine to start the Center for Psychedelic and Consciousness Research, making it the first research center designed specifically for psychedelic research in the nation. In 2020, Johns Hopkins conducted a small study of adults with major depression. Researchers reported from the study that 2 doses of psilocybin, along with supported psychotherapy, produced rapid and large reduction in depressive symptoms. In 2021, Johns Hopkins was awarded a grant for the National Institute of Health to explore the potential impact of psilocybin on tobacco addiction. According to Ursulano, this was the first grant from the National Institute of Health that has been awarded in over half a century to directly investigate the therapeutic effects of a classic psychedelic. Ursulano also points out that 0 grants were given by the National Institute of Health between the years 2006 and 2020. This is an extremely huge step in the field of psychedelic research, and I believe that this grant was the foreground for the explosion of interest of psilocybin within the scientific community. What do we know now? According to the Archives of General Psychiatry, evidence suggests that 1 or 2 administrations of psilocybin with psychological support produced antidepressant effects in patients with cancer and in those with treatment-resistant depression. According to a study published by the New England Journal of Medicine, the outcomes of the study generally favored psilocybin over escitalopram, which is an antidepressant known as Lexapro. According to the Drug Policy Alliance, psilocybin is not considered to be addictive, nor does it cause compulsive use. One reason is that it is an intense experience that is physically and mentally challenging, which may cause people to use psilocybin to limit their frequency of use of other substances. The hallucinogenic compound psilocybin can help treat depression, anxiety, and substance abuse, said Dr. Roland Griffiths at the recent NIMH Director's Innovation Speaker Series lecture. Overall, I think it is a shame that we have just recently been allowed to research and perform clinical trials on a drug that is older than mankind. I believe that psilocybin-based therapy will be one of the most prominent and substantial mechanisms of treating mental health disorders that have only continued to rise in the past few decades, as shown by this chart. I believe that the negative stigma surrounding psychedelic drugs is subject to change dramatically, and I think that it is only a matter of time until psychedelic-based therapy is at the forefront of medicine. I hope that this presentation has been informative and that you all may reconsider your personal understanding of the power and societal impact that psychedelics may have. Here are some of the sources that I used for that, for those images. So thank you guys for listening.